All right, let's start off with our first big story. Today, October the 10th, is the World Mental Health Day. The theme of this year is psychological first aid.
The World Health Organization on this day seeks to raise awareness on mental health issues around the world and mobilize effort in support of mental health. Let's take this report.
Ask a cross-section of Lagosians what they know about mental health and their reply would amaze you. TVC News crew did just that, and here are some of the answers we got.
Even without interacting with them, you will know from their outlook, from the way they dress, from the way they behave along the road, you will know.
Somebody is speaking something along the road, or somebody is just saying something that is rubbish from somebody to be saying. It's very difficult it's very, very easy for you to know that this one is quite right, it's not okay.
But mental health, illness or disorder is more than just how a person looks. A person with sleep disturbance, appetite disturbance, marked unusual behavior, and other related symptoms could be exhibiting a disorder that could be mentally related.
Any behavior, whether religious, social, or culturally sanctioned, that an individual, undertakes that causes distress to him, and then causes distress to significant others, and then the society finds it difficult to accommodate, then that's mental illness.
When we talk about mental illness, we're always looking at those that are walking naked, and they're extremely few compared to the larger society.
The World Health Organization says mental well-being is a state of complete physical, mental, and social well-being, and not merely the absence of disease. According to the study made by the Mental Health Awareness Advocacy Foundation, about 40% of Nigerians, that is, about 64 million of the population, live with one form of mental illness or the other. Professionals in the field have also attributed most of the problems we have in the society to mental illness.
When you go to the north, to Maiduguri and some other places like that, what they will tell you is that they are no longer sleeping. They are no longer sleeping. I've interviewed some of the people that work there. They are no longer sleeping. And when people are no longer sleeping, it's one of the things that precipitate mental illness. Now, the insecurity level in Nigeria is already pushing our people to that level. Then you talk about trauma that people are going through because of crisis of insurgency, not to talk about the problem of poverty in the land too, that is getting all of us under terrible anxieties every day. Everybody is panicking. There's high level of hopelessness in our young people.
Mental health advocacy says a lot needs to be done, not just to create awareness about how people ought to take care of their mental health, but also the role the government has to play in providing facilities, adequate budgetary allocation, and a legal frame that defends discrimination against patients.
It is now obvious that unlike what most Nigerians think, mental illness is not just about people walking about naked on the streets. It is a lot more deeper than that, and it's worth paying attention to. Wendy Abu, TVC News, Lagos.
All right, with us in the studio is a clinical psychologist and the program manager of Mental Health Foundation, Nathaniel Ayadichi. It's good to see you. Join us. Good morning. And we also have a consultant psychiatrist here, Dr. Olufumilayo Akinola. It's good to have you join us. Doctor, welcome.
Good morning.
Good morning.
Nice to
All
be
right,
here.
let's start it this way. Anytime we mention or talk about the issue of mental health, in the minds of Nigerians, in the minds of maybe Africans, they always visualize that man walking on the street, either naked or picking this or picking that, or talking to himself. Now, what really is a state of mental health, if we can understand the basics?
Okay, well, if I go on, yes. I want to say that mental health, really, it's a concept that is related to our social, and our relationship, social life, our relationship with others, how we think, how we plan. You have a goal, you're able to achieve it, and you're able to move forward. So in relation to others, not just yourself, your family, and the environment where you live. So that's what basically good mental health is all about. So if there is a break anywhere along what I have said, your relationship with others, you have a goal, you plan, you can't execute it, why are you not where you're supposed to be? So we start thinking that there might be something wrong. So it's just a concept of being well-being, emotionally, your cognitive well-being, and of course your physical, because there's no health without mental health. So that's just the concept of good mental health.
But you hear some at times where some people have said to have been able to mask their mental illness well, that you won't even know that something is wrong with them. How do you juxtapose that?
Well, recalling what mental health is, according to your show, the mental health is a state of well-being in which an individual realizes his or herself and can cope with normal stress of life, can work productively, and can also contribute to...
All right, Nathaniel. I'm hearing that they can't really hear you at home. They're going to work on your audio so we can get to hear you more clearly. But let me come to you, Dr. Akinola. When we talk about, you talked about cognitive well-being, emotional well-being. At the point where someone walks on the street naked, for instance, at what stage of the absence of well-being is that?
Well, I want to believe that, of course, by the stage that person is walking on the street, then a lot has really gone wrong. Okay. Of course.
So where does it start from?
So it starts like the questions she asks, that some people are able to mask their symptoms. Well, it's not that they really mask it. It's showing, but it is the awareness, the ability of the family, the people they live with, where they work, to pick it, that there's something wrong and sick, because they know, most times they know there's something wrong. But you know, we all need help once in a while to go to the appropriate place. They know. That's when sometimes you say, this person is now becoming more religious. They wake up at night and pray, 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 pray. Because they know that there's something wrong and they don't know what to do. So they start fasting, they'll start praying, and you know, and everybody will say, why is this person doing this? Because the awareness all over the nation is quite low. So we cannot pick it and we cannot help until it becomes very frank. I had the patient was in school, university, and he kept on calling his mom. People are after me. I can't, think very well in class and all that. A Muslim man, they kept on praying at it. They didn't know what to do until it became very bad. Now he wanted to kill himself. He ran away from school. Then he told the mother, if you do not help me, for 2 years, they had been telling the mother that there was something wrong. But they didn't know what to do. Like, if you do not help me with all these things that I'm going through, I'm going to kill myself. That was when they now started telling people, and they were advised to bring him to the hospital. So it's not as if the symptoms are masked. It's because people, they see, but they say, it's like a child and adolescent. It's stubborn conduct. They said, the father did that too. We outgrow it, instead of seeking for professional help. So it's not as if they mask it. People see.
But is it possible to go through your life, someone's life, a whole lifetime, and not detecting that there's something wrong, and psychologically something is wrong?
It can't be a whole lifetime, because like you said, at a point there will be total breakdown, and that is when, of course, the person will start removing their clothes, they start shouting, fighting with people without provocation. So now everybody knows that there's something wrong. But that thing had been going on for over 6 months, that people didn't pick and they didn't offer help.
Okay. We'll come back to all of this. Now, mental disorder, according to World Health Organization, is all diagnosable health conditions that are characterized by alterations in thinking, mood, or behavior associated with distress and or impaired functioning.
Nigeria's mental health policy was first formulated in 1991 and states that mental health should be integrated at the primary care level. While this is not fully operational, a bill for a mental health act, which has been in the National Assembly since 2003, is yet to be passed into law. We're going to ask our psychiatrists in the House what our thoughts will be on that. And psychiatric research in Nigeria was greatly influenced by the work of the Arrow Village team in Abeokuta, who pioneered community epidemiological studies among the Yoruba people in collaboration with Cornell University in the USA.
Now, Nigeria was one of the key centers for the landmark international pilot study of schizophrenia, the 10-country study of the incidence and manifestations of schizophrenia. schizophrenia. Yeah, I got
Schizophrenia.
Now, Nigeria's first asylum was established in the southern city of Calabar in 1904, and shortly afterwards, in 1907, the Yaba Asylum was established in Lagos, also in the south. These asylums were run by medical officers, as there were no psychiatrists, and provided essentially emergency and custodial interventions.
In 1954, the Arrow Mental Hospital was established in Abeokuta by the British colonial government in response to the need for improved mental health care. According to Commonwealth Online Nigeria, the most commonly diagnosed mental illness in Nigeria is mood disorders, while psychoactive substance misuse accounts for around 10% of cases treated in mental health facilities. The World Health Organization says mental health care in Nigeria is grossly inadequate, with the ratio of psychiatric beds being about 0.4 to 10,000 persons, while for psychologists and social workers is 0.02 to 100,000 persons.
Now, there are 8 common mental disorders affecting Nigerians, and they are the schizophrenia I mentioned earlier on, anxiety disorders, personality or bipolar disorders, premenstrual tension, postpartum blues, postpartum depression, and postpartum psychosis, and sleep disorders. These are some of the breakdown there. All right, let me bring in Nathaniel in here right now. You have been working with a lot of people, counseling and all of that. Now, basically, what are some of the causes of some of these mental disorders, whether it's at the advanced level or it's just at the preliminary level?
Yeah, thank you very much. The causes, I can put it in 3 areas or 4. First is the biological causes or factors. These are factors, and the biological factors, that means one of it is genetics. Genetics in the sense that sometimes you cannot really say the reasons why someone will actually have a mental illness, but research have actually justified that certain genetic loadings predisposed mental illness. Also, we have social factors, problems of financial stress, financial problem, relationship problems. We also have problems such as events of childhood traumas, event through childhood stages when someone grew up with a traumatic experience during the childhood stage. Now, also we can look at the other factors beyond biologic, social, and also the psychological factors. Low self-esteem, where people have problems, developing appropriate self-esteem. Also we have problems like sleeping problems. Also, we have problems. Some of those problems are.
How much sleep disorder do you have? Do you have a breakdown?
Sleep disorders.
Yes.
Now, we cannot actually justify the fact that this is a numbers of sleep disorders, but the sleeping problem itself are part of things that actually preempt or predispose mental illness. Now, for the common man or the public, we classify mental illness as common mental illness and severe mental illness. Now, the commons are those ones that actually they are common around us, problems with anxiety and worries. You have loss of loved ones or problems facing traumatic memory. Then also overwork or maybe excessive work involvement. Also, we have some problems such as physical illnesses. All these are common mental problem like anxiety.
I like the way can we stay on one or two of some of those points?
Now,
the sleep disorder, maybe we'll go back to that. But you also mentioned excessive work habit.
Yes.
So what is recommended for you per day, for instance, as a normal human being?
Exactly.
Before you reach your limit.
Because I know the kind of work we do here sometimes.
So
we can be in the office for a long period of time. So let's have you advise him.
Okay. Sleep is very essential for the renewal of the brain. So normally a normal woman being need up to 6 to 8 hours sleep per day. So and when you start depriving of yourself of this normal sleep pattern or habit, then
must
gradually
the 8 hours be at a stretch? Can it be broken into 2? You have 5 hours now, you have 2 hours later. Is it okay?
Well, you can cope along with some time, but at the time you will begin to notice some restraint in yourself. That tells you a signs that you need to actually, create that hours for rejuvenations of your body.
Okay, what about the work hours?
The work also, and the body itself also work, remember, it's not about just your physical body, the mental, the brain itself is one that does all this. So you got to a point in times that, the body, the brain is overloaded or stressed. And, just as your physical bodies, you can be stressed physically. Then the danger of this is when you get to mental distress or mental stress or mental fatigue. So those little signs, we have signs and symptoms. Those symptoms you begin to notice signs of, tiredness or, times of agitations, all those slight signs shows that something is wrong upstairs, which you need to begin to pay attention. That is even the needs of psychological forces for us to actually educate people to know that, just like your vehicle that you can walk in, drive for hours, and you can't just say because I love this car and then you drive it for a whole week. You also need to let the engine rest.
All right. Okay, let me bring in Dr. Akinola in here. The way we are in Nigeria, a lot of people say we go through a lot of stress, societal stress, especially when people have different economic issues, there are political issues, there are societal issues. But the point is, what kind of, let me say, concern should be in the minds of the average? Because he talked about stress in the workplace and all of that. So it means a lot of us may have some level of, I wouldn't use the word disorder, but may not have the kind of well-being that is necessary. So what should be the concern? How can we keep ourselves under check?
Well, I want to start with the fact that, number one, we should know ourselves. You should know that when your body is telling you there's a rest signal that I'm tired, so you need to take care. If you look at the work ethics, you're supposed to work for like 8 hours. Even if you take a call afterwards, for us that are in the medical field, you're supposed to have a rest the next day, so that you can get back into top shape. So the idea is know yourself. You work, you rest, you eat well. All the stresses that we go through, most of the time we spend it driving. You are seated there, traffic, hold up, you are stressed, you have an appointment, you need to get it. So that's mental stress. And the physical, and we sit all day. So we are not exercising. It's like we are not taking care of our body, because you sit for how many, you just said a while ago that you spend long hours. I'm sure you spend long hours in the office sitting down. That is not good. So even the long hours, you're supposed to get up periodically, stop sending your secretary and your office messenger, get up yourself, get your file from wherever the file is, put on the fan yourself. During your lunch break, you go out, you walk around, you come back into your office, because you're seated for a long time. You need to get the blood moving. So these are and when you're going to sleep, like I said, sleep is very important, 6 to 8 hours. Some will say over time, they'll spend like 5 hours. Fine, it's working for you, but you need to sleep, because it is at night that your brain, everything you've done, everything you've learned, I tell the students you need to sleep so that the brain can store it, then you remember when you wake up. So these are things, restorative sleep. And by the time you now start sleeping, you wake up in the morning, you don't feel refreshed. Then there's something going on. It's either you have to go on vacation, you take a leave, few days off work. I need to rest. You understand? Then do we eat well? Most of us leave home at 4 a.m. because of the traffic. So, but once you get into work, work starts, you go all day. So there's a lot of fatigue. You're stressing the body. Like you said, it is a machine and you have to take care of it. So we need to eat well, we need to sleep, and we need to exercise, even if you can't go to the gym.
And some people have said it's not even good to skip breakfast. Is it correct?
Because we have fasted all night. Most times we eat, sometimes now they tell us we are losing weight. Don't eat after 7. So you can imagine, your last meal was at 7, and you will not eat till when the next day. You wake up at 4, you leave the house, maybe 12 the next day. That's over 12 hours fast. So that is not good. And so that breakfast in the morning, you need glucose for the brain. So your brain is fresh, you're sharp, you can work, you understand. You're not, because by the time you go to work, you've not eaten. By the time you've worked for 1 hour or 2, you start having headache. As I was coming, somebody was telling me, I've been having headache for like a week now. I've used all the medication. I'm sure I said, okay, when I get to work, we'll talk about it. He said, she's not sleeping well, she's not eating well, you know, she's stressed. Are you thinking, are you worried? So have you done any investigation? So these are issues. So there's no health without mental health. Okay. If we are stressing ourselves, the body will just break down one day.
Okay, my question now is for both of you. Where does your work start? You are a psychologist, you're a psychiatrist. Where's the difference?
Yes,
what is the difference?
I am a psychiatrist is a medical doctor.
Or I'm going to let you both answer these questions, but let's go out on the TVC Entertainment. Viewers there can continue with the program. We're discussing the World Mental Health Day today, and you can continue with the program on Concert Channel 190 and DSTV channel 418.
Go TV 45, SCTV 510. You want to hear the answer, really? So click on. Let's continue the conversation there.